Good morning. My name is Sarah Mock. I am with Broomfield Public Health and I use she, her pronouns. I am our health planning and systems manager. And I'm joined today by Kelsey Warren, our community health coordinator. Kelsey can wave. And then our main presenter today is Sarah Torres. And I will give her a better introduction in just a minute. But just a little bit of housekeeping. We, like I said, are recording this. This can be shared out at a later time. We will also be sharing with you a quick guide document more at the end of the presentation. So if you're trying to take notes or follow along, we've got you covered. We will have a document that kind of helps you through this. But we didn't want to give it to you too early if you got distracted. So if you do have a webinar, please feel free to raise your hand, and our wonderful Curtis in the background will unmute you and allow you to speak for yourself, or feel free to use the chat button. Similarly, we will be asking you some questions along the way because we're very curious about a couple of things around these dashboards and your perspectives. So otherwise, you will be muted throughout, so no worries there. If you need to go grab a drink of water or something, please feel free. We will be using that chat to share out any links and materials along the way. And so housekeeping done. Let me introduce Sarah in a much more formal way with a lot more gusto. Sarah is our public health data analyst. She's been with us for 2 years at this point and will be our primary presenter today. Her role here in the department is gathering and interpreting data to inform our departmental decisions. And these dashboards are really a reflection of the work that she's been doing over the past 2 years, quite frankly, around our community health assessment. These dashboards are going to give us a slice of what we have provided or used for our community health assessment and are now putting out into a public format for everyone to have access to and be able to use. This data has given us a really deep understanding of our community and in particular, how we see different groups functioning in Broomfield and the experiences that they're having. So we've really designed these to be supportive of our collective efforts. So across our different departments or our different professional work that we do as a community, whether you're in the nonprofit space or a foundation space or in transportation, we're ready to see what we can do to support each other. So Sarah will be walking us through 3 dashboards and a surprise edition, which is exciting for us to be able to release at this webinar. And these dashboards really describe the health status of our community. And we will be looking at health behaviors, health outcomes, and social determinants of health that affect those behaviors and outcomes. So that's my brief introduction, but just to get us all warmed up a little bit, if you had to write a grant today, I'd be curious about where you would go to find data about our Broomfield community. And if you wouldn't mind putting it in that chat, that'd be just really fun to see. Sarah, do you want to go ahead and get started?
Yep. Thank you so much for the introduction, Sarah. We are very excited to be here. And I want to, as the answers come in, like I'm seeing a lot of census data, CDPHE. These are also the places that I would go to. It's also places where you can get lost in the amount of data and trying to find the right geography, the right demographics. So while we keep getting these answers, I want to start with a little agenda. So during this presentation, I'll start with a short introduction on where this data came from, walk you through how the data has been organized, where it comes from, and how we have been able to group it in terms of geography and demographic groups. Once we set the stage, I will introduce the dashboards, make an introduction to Tableau, which is where these dashboards live. And then we will navigate through the dashboards. And finally, if time allows, we will introduce the socioeconomic maps, which is the surprise that we have for all of you, and present the platform and navigate through them. I know it's a lot, so stay with me. Feel free to ask any questions in the chat during the presentation. Kelsey will be monitoring the meeting chat for your questions, and we will have opportunities to engage throughout the presentation by typing in the chat, raising your hand. And when you raise your hand, you will be unmuted by our tech support. So we are very excited to do this, and feel free to ask questions throughout the presentation. So let's start by sharing why we're doing this. This is an effort to share who we are and to support our partners and community in making better decisions that will take us closer to an equitable, healthy Broomfield. Today, we'll walk you through the structure of these dashboards, which are organized according to the Barhai framework of equity. This framework categorizes the data into 3 key buckets: social determinants of health, health behaviors, and health outcomes. I'm wondering, as we start this conversation, what are the biggest obstacles for you to access Broomfield data? And I'm talking specifically about Broomfield, but like local data. Please raise your hand to be unmuted or type these in the chat. I will double check as you answer once I'm done with the next slide, so we can keep going. I'm really excited to show you these dashboards. So the Barhai Framework of Equity was developed by the Bay Area Regional Health Inequities Initiative. It's a public health model that emphasizes the root causes of health inequities, and it's central to our approach. It helps us to understand the root causes of health inequities and guides our data collection and analysis efforts. It categorizes factors in data into 3 main buckets: social determinants of health, health behaviors, and health outcomes. The social determinants of health include factors like economic stability, education, neighborhood and built environment, and social and community context. These factors that are influencing the conditions in which people are born, grow, live, work, and age. After that, we have the health behaviors. These refer to the individual actions that impact health, such as diet, exercise, substance use. And finally, health outcomes, which is what we usually measure, or most often measure, which are the results of these determinants and behaviors, including indicators like mortality rates, chronic disease prevalence, and quality of life. Have you encountered this framework before? Does it make sense? I will kind of go back to our first question and pose this question again. So in the first question, we were talking about where would you go to find specific information for Broomfield, or what is hard about it? And it is very hard to find county-specific data, hard to remember what resources are available and the different data types. I totally agree with that. And now I want to kind of sit here and have you think about like your own line of work. You are likely to see and encounter individuals who experience social determinant of health barriers, which prevent them from achieving their best health outcomes. Have you encountered this framework before, this Barhai framework? Does it make sense to think about public health in this way for your work? Please, again, if you have some thoughts on this, I would love to hear them. Raise your hand to be unmuted or type your answers in the chat. Okay, so I see that some of you are familiar, like Dana, you're familiar with this idea. I think it's an approach that it's starting to become more and more common, which is really exciting. Okay, now that we've discussed how our data is organized and like what our logic to this organization is, let's talk about where this data come from. As you can see, we have gathered data from a wide variety of sources. Highlighted are the most commonly used databases we use. These are the American Community Survey, ACS. The ACS provides data on factors like income, education, housing that influence the health behaviors. Understanding these social determinants helps us to contextualize behaviors like exercise, diet, and healthcare access. The American Community Survey is based off the census. Then we have the Behavioral Risk Factor Surveillance Survey, BRFES. This is one of our primary sources of data on health behaviors. The BRFES collects information on health-related risk behaviors, chronic health conditions, and the use of preventive service from adults across the US. It provides key insights into behaviors like smoking, alcohol consumption, physical activity, and diet. Colorado Department of Public Health and Environment, CDPHE, offers a range of data on public health initiatives and outcomes, including behavioral health data tied to state health programs and interventions, particularly around mortality and birth. We use Health Access Survey, which focuses on the health of Coloradans, provides detailed data on health insurance coverage, access to healthcare, and health behaviors. The CHAS helps us understand how these behaviors vary across different demographics and regions within Colorado. And the Healthy Kids Colorado survey focuses on behaviors of Colorado youth, providing valuable data on topics like physical activity, nutrition, and substance use. Understanding youth behaviors is essential for early intervention and prevention efforts. So by integrating data from these varied and credible sources, our dashboards offer a robust and detailed picture of health behaviors and outcomes within Broomfield. This allows us to identify trends, disparities, and opportunities for intervention, helping us all work towards a healthier and more equitable community. You'd be interested in what geographies are available, so it's important to keep in mind that not all data sets offer the same level of geographic detail. When using our dashboards, you can filter data by geography where available, and the dashboards will give you on the level, when using our dashboards, you can filter data by geography where available, and the dashboards will guide you on the level of detail you can expect from each source. We're only displaying data available at least at the health statistic region level. Our health statistic region is region 16, which encompasses Boulder and Broomfield. This is what you're seeing in this map. The demographics available, similarly to the discussion on geographies, we've made every effort to include demographic information across all data sources. However, the way demographic groups are categorized may vary depending on the source, and this information may not be available for all data sources or years. Additionally, it's important to note that in smaller counties like Broomfield, data may often be suppressed when it's broken down into specific demographic groups due to privacy concerns or small sample sizes. When dividing by categories in Broomfield, data is often suppressed due to sample size. For example, if you were to look at a specific behavior happening in a specific group within a specific geographic area, it could unintentionally reveal the identity of a person. For example, if we're reviewing deaths due to suicide in Broomfield in 2023 among young adults, 18 to 24-year-olds, and additionally among those who are Black, the data might unintentionally reveal the individual's cause of death. Therefore, the data would be suppressed. Okay, this is a lot of information, so I really want to make a stop here and ask, is this clear? Are there any questions about grouping, geographic details, any other part of how the data is presented? Please raise your hand to be unmuted or type your questions in the chat.
Sarah, I saw in the chat around populations with IDD, and I know that that can have a fairly broad definition. So I just want to point out our disability status is reflective of how the census categorizes disabilities and asks those questions. So hopefully it's of some help to have that information, but I know it's probably not meeting your full definition of IDD. Dina, we will get to the housing one. I'm not sure if it's going to be as detailed as what you're hoping for, but we're going to give it our best. And just to kind of, when you guys are asking these questions, it really is helpful for us to know the level of detail that you're asking. We fully intend that this is a work in progress, and as data sources are available or expanded in some way, we have the opportunity to revise the presentation of this information without losing the baseline information as it stands. So thank you. The more you tell us, the more we respond.
Yeah, thank you, Sarah, for taking some of these questions. I now would like to start our tour of the Broomfield Health Dashboards, which you can access online. So if you can, please follow along on the link we are providing for you on the chat. I totally agree, Sharon, with the idea of housing becoming a demographic category. The keys, how different surveys are gathering the data. That's kind of like our constant back and forth. What data has been collected so we can respond. All right, so follow along with me. I will start the navigation from the Public Health and Environment main page. Let's start with the menu on the left and click the About. Around here, if you're following along with me. Once you click here, you will have data and reports, and you're going to click data and reports or that plus sign. When you click data and reports, you get to this page. Please take some time to explore it. This is where we publish topic-specific data and other data-related resources. However, today, we are going to head to the Broomfield Health Dashboards item on the menu on the left, right here. And once you click there, this is the main page for Broomfield Health Dashboards. And please bookmark this page in your browser so you can easily access it later. This dashboard is a tool for exploring health data specific to Broomfield County, providing insights into various health outcomes, behaviors, social determinants of health, and the spatial distribution of socioeconomic status. When you first arrive to the dashboard, you'll see the landing page with several key sections. At the top, there's a navigation bar that allows you to explore different categories of data. Social determinants of health. Health is written as an acronym due to space, so SDOH. Health behaviors, health outcomes, and SES maps. This is socioeconomic status maps. We also have below that an introductory text explaining the purpose of the dashboard and how it can be used. And at the bottom of the page, you will find some additional information about the data sources included in the dashboard and a link to a form where you can make comments, give suggestions, and ask questions. So we can keep in touch and we can keep having a conversation. because you will be able to schedule time with me to discuss the data, which I'm always very excited to do. Okay. When you click, I want to talk about the dashboard, because when you click on the category, the button will lead to a Tableau dashboard where all the data is housed. So I'm going to do a quick introduction, a quick orientation into Tableau. This is the platform housing the data of the 3 dashboards. And this quick introduction will help you navigate through the dashboards. When you are in Tableau, in a Tableau dashboard, you can find the following. So you have navigation. Then you have the metric definition on the top. You have an option for sharing. Then you can download the visualization, so you can take this directly and use it in your reports. And you have an opportunity to filter by the years available of data. In this image, you have a menu of demographics. So what's kind of in this dark gray, the almost black, that's what's displaying, and the other gray is not displaying right now, but you could click on it and it would display. And then you have these gray lines displaying confidence interval when we have that available. Just a quick refresher. Again, this is part of that help guide that we will provide to you later on. But remember, confidence intervals indicate the range of values that represent the possible true values of an estimate in a population for a given indicator. Remember, this comes from a sample, so we are kind of guessing based on the sample what's happening at the for the population as a whole. Confidence interval reflect the margin of error. This margin tends to increase as our sample sizes decrease. We will provide a document at the end of this webinar that will have this type of explanation, so you can go back to them if you have any doubts. But I wanted you to kind of bring this concept back to the front of your memory to see what this gray line means, and remember why you would have it being bigger for the smaller region, the health statistic region, for example, that is marked over here versus what is marked for the state, like here. You see that the variation is smaller for the state. Usually for the state, our sample is bigger. Okay. So if we're clear, we're going to jump to the social. I'm sorry. The dashboard is designed to be highly interactive. You can hover over charts for more detailed information and customize the display setting to focus on the most relevant data to your needs. We're going to start by clicking on social determinants of health. Oh, I almost forgot a very important part. I apologize for the jumping, but at the bottom, you will always have the data source. So it will help you to understand why we have the demographics that we have and why the data is organized in certain ways if you see where the data is coming from. So don't forget to look at the data source. So let's start by clicking on the social determinants of health section. This area will provide us some insight into the conditions in which people live, work, and play, such as income status, education, and housing. So I'm sharing here. Social determinants of health. We will start by exploring insurance type. So I will hover here, access to care, insurance type. When you click on it, it's supposed to be loading faster, so I apologize. The first thing to note is here is your navigation buttons, data source, in this case, the data is organized by the trend. You have private insurance, public insurance, and uninsured, and how it's trending over time. You can see the data comes from 2014 to 2022. This is BRFA's data. The data we're showing to you is from the health statistic region, and in orange, it's Colorado data. You can see that for private insurance in the health statistic region, the percentage is higher, while for public and uninsured, the percentage is lower for the health statistic region compared to the state. Here is something important. We always want to show compared to what. So you will most likely always have the state as a reference. In this case, if you want to explore the demographics, you have this button over here. And you get to the menu of demographics. Let's look at the disability status. So notice how here in 2022, so here is what year of data you're looking at, and here is the options you have within this category. It only shows without disability. If I go to the menu over here to select a year, and I changed that and make it 2021, you would see that now you have two available, the two options. This means that the data in the 2022 data of with disability was suppressed, and for some reason, and that's the reason why we're not displaying it. So here you can see the comparison between those with disability versus without disability that are covered with private, public, or are currently uninsured. You can open several categories at a time. Once you're done exploring this, we will go back. So you use the arrow. The arrow will take you back to the trend, the trend over time. And then you press for the house. I know this is a lot, but repetition will help us get through this. You'll do the home button and get back to social determinants of health. I am going to show you another two examples because I want to show you the breadth of data sources that we have. So I want us to go to unemployment. In unemployment, first notice that for this indicator, the demographic groupings are right besides the trend. This means we don't have other demographic grouping available, such as LGBTQ status, disability status, or insurance type. The data source is the American Community Survey, so the race and ethnicity categories may not be exactly the same as the previous indicator that we explored that came from the BRFAS. Also look at the year filter. As we filter through different years, the available demographic groups are different. Very similar to what happened in the previous one. So you can see these are all the demographic categories available for Broomfield specifically. And so remember that as we're cutting the population into smaller groups, it's harder to have numbers available. So this is what's happening over here with demographic data. If you look, our estimate is 0%. 0% is statistically not really even possible, but the range, the confidence interval, is between minus 11.3, which is not possible, to up to 11.3. That being said, the sample was probably really small for American Indian and Alaska Native who live in Broomfield and are unemployed. I want to show you one last example. Sorry, I pressed on the home button to get back to this menu. I want to show you one last example before we jump to the next dashboard. So let's navigate to water quality. So if you go down for housing quality, we have water quality monitoring. So the current lead and copper regulations require that our utility provider tests homes that are most likely to have sources of lead in their drinking water. This means homes with lead service lines, which we have none of in Broomfield, or homes built between 1983 and 1986 due to the use of high lead solder on copper sites. If the public water system has too much lead or copper in the water, that's called a violation. And this happens if 90% of the water tests during a period between January to June or July to December show more than the allowed amounts. The allowed amounts for lead are 15 micrograms per liter, and for copper is 1.3 milligrams per liter, and the 15 for copper are micrograms per liter of water. This is lead, and for copper, 1.3 milligrams per liter. So in this graph, we marked what the action levels are. These are, so if these 90th percentile were above those action levels, that would be a violation. They're clearly below, and we update this annually. This data comes from Broomfield Utilities. So what I wanted to show with these 3 examples is we have a wide variety of data sources, and each data source and indicator requires a slight different approach. So when you're looking at this, we need to take the time to look at who is this data from and how is the data organized to truly understand the indicator. Okay. Now I want us to navigate to health behaviors. So if you go back to your health dashboard, I want you to click on the health behaviors. And I would like you all now to participate. I want this to be a little bit more of all of us instead of just me guiding us. So please participate. We are going to pop up a poll right now, and please let me know what you're most interested in exploring for this section. You will see the poll is up, and please choose one of the following options. We can do reproductive health, maternal and child health, preventative health services, substance use for adults, or substance use for youth. So I'll give it a minute, and then we can go and explore. Okay. It looks like substance use for adults is what has the most interest right now. So I will go ahead and do substance use for adults. And we will go ahead and look at alcohol consumption. For some reason, I want to go there. All right, so alcohol consumption. First thing I would do when I would get into the data is see, okay, where does this come from? So it's from BRFAS, the Behavioral Risk Factor Surveillance Survey. We have the data up to 2022. We see that the health statistic region, which is Boulder and Broomfield, and the state kind of have stayed within the same, very similar levels. If I hover around each point, I can see that for Colorado, the estimate is 19.2. and for the health statistic region is 19.1%. So they're very similar. So let's explore the demographics for alcohol consumption. So when I see this, I am also wondering what was really asked. So that's the metric explanation down here. Percent of adults reporting binge drinking. So 5+ drinks for men or 4+ drinks for women in the past 30 days. So let's look at the demographic information. Does this change between different groups? So in 2022, when I look at the health statistic region versus Colorado, it looks pretty similar. The distribution is pretty similar between age groups. Race and ethnicity, we see, I would look at this, a native Hawaiian and other Pacific Islander only non-Hispanic, and I'd be like, wow, this confidence interval is too big. So I'll take this, that is high for this community, but I'll also say it might need a little bit more exploring on the ground. But if we look at why only not Hispanic, I like that confidence interval is small, between 17.6 and 26.6, which is similar to the state, slightly higher for our region, Broomfield and Boulder. Let's explore the LGBTQ+ status. LGBTQ+ community is slightly higher, but it's not statistically significant for our region. However, for the state, the difference is statistically significant. So it's a demographic group that I would still keep an eye out for. We can look at the disability status, similar to the first indicator we looked at in social determinants of health. I only have information for those without a disability, so I would look into the year filter, see if I can have more information there. It's thinking. It's not showing much more information on disability here. I don't know. So I would look, oh, it's filters. The beauty of technology. It's beautiful when it works, and it's really hard when it doesn't. So right now, I want you to know, because it might happen, if you hover around, it tells you what year you're looking at. So just make sure that the years are matching. Sometimes it loads, the loading doesn't sync. So please make sure that you're looking at the right year. So 2022, 2022. Okay, let's see what happens in difference between insurance types. Okay, there's not a lot of statistically significant difference, but there is a difference. So it's important to explore what's happening here. And if you want to see, well, has it changed? Again, go to the filter, look at what's happening there. And then once you're done exploring the demographics, you can use the arrow to go back to that trend over time over here. And then once you're done exploring, you can go back to the main menu, and I will just do one more for exploring here. We are looking at marijuana use in adults. Again, looking at how the trends between the health statistic region and the state, if they are similar, which they are similar, slightly higher for our statistic region. Same data source, the purpose is over here, demographics, and you can explore how it's doing by demographic. Okay, in the interest of time, I am going to stop sharing about health behaviors, and I'm going to go ahead Okay, I am going to stop here, and I am going to ask if there are any questions. This structure is the same as the health outcomes. So I wanted to give kind of the floor back and let you raise your hand or to be unmuted, or type your questions in the chat. If you have any questions about Tableau, how the data is organized, and what I presented up to now. I know it's a lot.
We had a couple of questions in the chat that we've been able to answer along the way, except for one from Nikki that I think we'll come back to with the socioeconomic status maps. And that's wondering if there is mapped data connected to language preferences in Broomfield. So I think that's actually a great transition over to the SES maps, and we will let Sarah take over to those and do a quick orientation of what's in those maps and how to navigate them. I will say learning to interpret data off of maps is a new skill for me, and I've been learning a lot from Sarah about just where we can use this information and how it makes sense to look at. So Sarah, if you want to take us over there. And then while she's doing that, I just want to give our GIS department a big shout out. They have been really instrumental in making these available to us, and well, all of us really, as we are really looking to provide this information to the community as a whole. I will say during COVID, our health department was really able to take a lot of action steps based on mapping and understanding where COVID vaccines were not being administered, or where uptake was, or what communities were not benefiting from the availability. And so we've really tried to grow from that experience and understand what interventions we can put into place based on some of the information that's contained in maps. So Sarah, with that, I will be quiet and let you go for it. And don't forget Nikki's question.
Perfect. Yes, it is a great segue, and we don't have any displayed data yet on language. But I want to walk us through the maps, and then I'll bring us back to the language idea. Okay. When you click on the button for SES maps, this is where it will take you. I want you to, I know that at least I usually ignore this first screen. Please don't ignore it. This one lets you know that what you're going to see is all in comparison to Broomfield itself. So whatever you see as high or low, it's not comparable to the rest of the state, not even to our counties beside us. This is comparable within Broomfield alone. So our areas with a higher socioeconomic status are higher only in comparison to others within Broomfield. You can say, okay, and welcome to the socioeconomic status maps. The Broomfield socioeconomic status maps offers an interactive way to view and analyze data about the population in Broomfield. It covers categories like income, education, and more at the census tract level. So let's get familiarized. With how to navigate this. And this is a slightly different than Tableau. So in this, you have the legend on the left. Then you have years available for the socioeconomic maps, years available for a diversity map, and then years available for both maps to display them together. You have more information about the maps and how to read them, and the layers menu, which I will walk us through how to navigate them. And at the bottom is the data set source. This takes you back to the demographer's office where this data comes from. Oops, not there yet. Okay. Now I am going to show you in these maps. Let's start by looking at only one layer, because what is very exciting about these maps is that you can look at layer by layer. So you will go to that layer menu that I showed you earlier, right over here. Oh my goodness, there, it's right over here. And you can turn off the layers on and off. So we are going to focus on median household income. That means we're going to turn off all the other layers. But percent of the population with a bachelor's degree, population with no high school diploma, percent unemployed, percent below the 150% of the poverty level, percent renter occupied housing, percent owner occupied housing. And when you turn everything off, except for one layer, what you have in this case is the median household income. The first thing I want you to note here is that the legend that you should be looking at is this one on the left. The socioeconomic status will not match, because the socioeconomic status is made out of the compounding of all the layers, one on top of the other, so it creates these brighter colors. So when you look at this, you can see how median income is distributed across Broomfield. Another important thing with the income is that it has been adjusted to 2020 US dollars. And you might be like, why would I ever do that? You want to do that because you have several years of data. So if you're going to try to look at how income has changed across years, you want to make sure that it's adjusted for inflation. So it's at the year 2020, and this will be changed every 5 years. So now I want you to, remember that all that you're seeing is in comparison. So this darker area that is a lower median income is lower to the next one, only in comparison to other Broomfield areas. Is that clear about the socioeconomic status, or like the one layer? Okay, I'm going to turn them all back on, and you are going to slightly see how that socioeconomic status stacks on each other. So household income. Then let's see what happens when you add a layer on percent owner occupied. And then you can add the layer with renter occupied housing, percent below 150% of the poverty level, percent unemployed. You start seeing that the colors become darker, percent of the population with no high school diploma and with a bachelor's. This is how you end up with the socioeconomic status map. Now, I want us to move to the diversity map. Over here, I know that we're short on time, so I can't do everything that I would like to, but if you're interested in seeing previous years, you can click up here on 2021, and you can compare 2022 to 2021 by moving around in these small menus. Okay, let's go to diversity. This map is displaying racial and ethnic diversity distribution in Broomfield. The following racial and ethnic categories from the American Community Survey estimates were used: white, non-Hispanic, Black, non-Hispanic, Asian, non-Hispanic, and Hispanic. By compounding these variables, we seek to illustrate racial and ethnic diversity by census tract. This map was created separately from socioeconomic status map because the relationship between racial ethnic minorities and the SES is really complex. Therefore, when we think about conceptually putting this map on the socioeconomic status map, an increase in racial and ethnic groups is not necessarily correlated to higher or lower socioeconomic status. And it really varies and can vary across different groups. So if we tend to believe that a higher level of minorities means a lower socioeconomic status, but that's not always the case. And I want to show you what I mean. Let's explore where the Black and African American population is within Broomfield. So we're in 2022. I go to my layer menu, turn off all the categories that are not the Black and African American community. So I turned off the other three. This map alone is showing the percent of the population who identify as Black, African American, non-Hispanic in 2022. So the majority live around this area. And when I say majority, if you look at the legend over here, it's like 7%, like 7% of the population in this census tract. But this is where the majority of them are. So I am wondering, well, does this match with the socioeconomic status? This leads me to go to the side-by-side map. So I go to 2022. They take a second to load. And I want all the layers for the socioeconomic status to be on, so I check. They are all on. And then I go over here to and again, just like I did previously, I turn off Hispanic, I turn off, white, Hispanic, and Asian, not interested in seeing those right now, just the Black and African American, and I can see them side by side. If you look at it, this level, it's a, let's say, socioeconomic status level 3, matches with the highest level of population that is Black and African American, which is not the lowest socioeconomic status within Broomfield. So you're able to start looking what correlates spatially to each other. Does this make sense? I'm hoping this makes sense. All right, so this is what you have for maps. I know that I want to leave a little bit of time for questions, which means I'll give you 5 minutes. If you ever are a little confused about the maps, we did create a document with really detailed information on how to read them and how to go through these menus over here in this information button. So it's an information page. So please explore it. So this concludes our tour of the Broomfield Health Dashboard. I really encourage you to explore it on your own, look at how it can support your work, whether you're looking to identify health disparities, track progress over time, inform policy decision. These dashboards, we hope, are a very valuable resource. If you have any questions or need further assistance navigating these dashboards, reach out to us. We're here to help. Please notice at the bottom of the landing page of the dashboards, there is a form you can fill out to make comments, suggestions, or ask questions about these dashboards. In this form, you also get to schedule time with me to discuss your questions about the data, or if you need assistance in the interpretation and use of the data. Kelsey is linking in the chat the form. And we understand it will take time for you to digest this new tool. So once you have had time to look into the dashboards, let us know what else you would like to see. Are there any gaps you would like us to fill? And I really appreciate all of your time. Thank you so much.
And just to reiterate in our last few minutes, the utility of this is based on your needs. We built this based on what our needs were during the community health assessment, but we want this to be a community resource. So I took down some notes about language mapping, what we can do with ward divisions. If there are other things that you'd like to see available to you, either in the dashboards or the maps, we're always open to those suggestions. I won't promise that we can do them because it is dependent on the data source, but we will try. So any questions that may be burning, please feel free to put into the chat. And if you think of something later, you can find us. So use that form and let us know what your thoughts are, or feel free to schedule some time with Sarah and she will be a great resource for you. And we will get one more demonstration of how to navigate over to those Tableau dashboards. Kelsey, would you mind putting in the link to our main page? So we're generally starting on our homepage just so that you guys know where things are housed. So if you're starting in the public health department, you can go over to that about sign on the left-hand side. There's a little plus button. Head down to the data and reports, one more plus sign. And then on our left-hand side, we have a link to the buttons that will take you to the different Tableau dashboards. We apologize that this is a lengthy process, but this is how our structure is. And we wanted you to know that there is other data outside of these dashboards. So Sarah is showing us the 4 different buttons that will take you into the dashboard. Sarah, if you don't mind hovering over one so you can see how it turns a teal color. If you click on that button that's in teal, it'll open up a dashboard. And Kelsey's also put in the direct link to that page that Sarah was showing if that's something you want to bookmark and have available for yourselves. Thanks for that question, Jennifer.
And Sarah, I did link in the guide up above too. This is the first time, I know we're sharing so many links with you, but this is the first time we shared the link to our guide. It's a Google document, and that's going to help you when you're in your off time, when you're applying to those grants. You need to figure out, how do I use this thing again? How do I filter all of that? That's going to be in that Google document guide. So make sure you bookmark that too, and save that as well, so you can utilize that to help you work through these dashboards and maps.
And if you forget where you bookmarked it, it's also posted on this Broomfield Health Dashboard page. Sarah, if you want to go down to the bottom, it'll show there's an additional information section and it has a link to that same Google Doc. So it's publicly available, because if you're like me, you forget what bookmark grouping you put it under. So you can navigate through that dashboard guide and find information about how to use the Tableau dashboards. And I see little heads popping in there, so I know you guys have found it. All right, any more questions? If not, you are welcome to ask questions later, provide some feedback about what you'd like to see on these dashboards using that form that's posted, that is being hovered over. We're very happy to take some feedback. Sarah, thank you so much for all of your work in this and providing this conversation for us. And thank you all for coming. We really hope that this can be a resource for our community moving forward. So thank you.